the Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Hi and welcome to Local Women's Aesthetic Podcast. I'm Emma Heaney and today I'm joined by two of the fabulous BTL team and we're going to discuss all about technologies and aesthetics. We're going to put aside the injectables and let's look at their portfolio of machinery. So today we have Rachel and we have Michelle. Hello ladies.
Hello Emma, and thank you for having us. Yes, thank you so much.
You are very welcome. I'm really excited to have you on because your portfolio of devices is fabulous. Not only does this team have aesthetic, but they also have medical and physio devices as well. But today we're going to focus really on most of the medical aesthetics. Is that okay?
Yeah, that's brilliant.
So let's dive right in. I was obviously with your colleague in Monaco at the weekend, and I'm sorry Dee can't be with us today, but I'm sure she's exhausted because it was a really busy weekend and the BTL stand was so busy. You some fabulous speakers on M-Face Eye,
yes.
And also on the Neo Sculpt Neo. That was a big one as well. It was got a lot of focus. But Michelle, tell us about the M-Face and the M-Face Eye. I mean, it's massive.
Yes, so it's really after exploding this year. So M-Face treatment works with two technologies. So it works with radio frequency, which will basically really shrink wrap and tighten the skin. It will stimulate your collagen and elastin. And the second technology is high FES. So high FES stands for high intensity focused electrostimulation. So it's all about building up the foundation of the face and lifting everything back up. We've just recently launched M-Face Under Eye, and there was an absolute amazing symposium and discussion all about that at AMWC the weekend.
Yeah, it was fabulous. It was absolutely fabulous. And I've had this treatment and it is so comfortable and the results are brilliant.
Yes.
It would be an area of concern for a lot of ladies.
Yes.
Yeah, I mean, and it's such a difficult area to treat. I mean, under the eye, you've got tear trough filler and really not everybody's suitable.
That's the thing. And like with the M-Face Under Eye, we can target dark circles, fine lines and the eye bag, so you can kind of get everything done in that one treatment. We do recommend a course of 4 ideally to get the best results. Like you said, it's non-invasive. There's no downtime and it only takes 20 minutes and it's really, really comfortable.
Yeah, it is. I mean, it feels like a tingling sensation. It's not like, I mean, the M-Face on submental, fabulous, but you're aware of it.
Definitely a little bit stronger.
But with the eye, it's just like a tingling.
Very soft. And I think that's what people are shocked about. I think they get such a good result after 4 treatments, but they're surprised at how comfortable it actually is for the treatment.
And so why is it improving the dark circles?
So it's basically stimulating the lymphatic drainage as well. And because it's building up the collagen and elastin, it can actually help thicken back up that area. The under eye area is the thinnest area on the face. It's only like 1.3 millimeters thick. So it is the area that we age first. And we'll see the kind of signs of aging in that area. So you're stimulating your collagen and elastin, but you're also building back up that muscle that becomes weak as we age. So that's why it will kind of help with the eye bags as well. So it's an unbelievable treatment.
Mm-hmm. And I would agree. When you look at injectables, there's nothing on the market that can do what the M-Face Eye is doing.
No, that's the thing. And it, like I said, it is the area that people will age first. So it's a massive concern of men and women of all ages.
Yeah. And you can have this treatment done and literally you can go back to work straight after. I mean, there's no downtime with it.
Makeup straight back on and back into work.
Yeah, it's fabulous. And you say 4 treatments is what you recommend?
4 treatments ideally, like depending on patients. Like some patients might need a course of 6, but they're done at 1 week intervals. And as we said, there is no downtime and you can do whatever you like afterwards. We're not disturbing the skin barrier. So there's no massive kind of guidelines people need to adhere to after having the treatment.
And I know we talked off camera and you said that the gold standard was to do the eye with the forehead.
Definitely. So the way M-Face is breaking down, it's kind of breaking down into 2 sections of the face. So the upper face, which is your forehead applicator and your under eye applicator, and then we also can treat the lower face with the cheek applicator and your submentum. So you can really do a full face treatment.
And I know people, whenever we have M-Face in the clinic, so I know people, one of the questions they ask me is, will it melt my fat? Because I mean, that's not what we want to do.
No.
And it doesn't do that.
No, definitely not. Like with the radio frequency, we only heat up the dermis between 40 and 42 degrees just to stimulate collagen and elastin. But on the submentum, we do want to melt fat.
Yes.
So the radio frequency we use is a little bit higher and a little bit stronger. So it will actually give a reduction of fat in the under the chin area. So you can get really, really nice results.
Yeah, and I think with the submental, you do feel it, but you want to feel it because you want to feel like it's working.
You can feel it pull. It's not uncomfortable.
Not at all.
The treatment time is so short. It's 28 minutes. So you can get like your full face if you wanted to do half and half, and you're in and out in an hour.
Yeah, I mean, and again, maybe there's a little flushed coming out, but nothing major at all. Nothing at all. And I think as well with the submental, if you haven't seen it, you've probably seen it on my social media. It's where you see the pads on everybody's face. Yeah. That's probably the best way to describe it. But it's you just feel cinched when you come off. I mean, you're like, oh, check me out.
And not everybody's symmetry is the same. So when I do M-Face on the cheeks, I have to lift, one of my sides lifts more than the other. So we have that versatility with the device as well, that if you have one area that lifts stronger than the other, we can tweak that as well.
That's the thing. And I'm actually treating a lady at the minute that had facial paralysis. So she had Bell's palsy a couple of years ago, and she has one side that's a little bit more dropped than the other. So we're actually correcting that symmetry with the treatment, and her results so far are absolutely amazing.
And so for maintenance, what's the recommendations from BTL?
Yeah, so the thing with it is we always get asked, how long did the results last? And that's the question that we always get asked. And it's funny because at AMWC at the weekend, Dr. Lee Walker actually shared some of his results. And he had a patient that he treated with 4 treatments, and he looked at her 12 months on, and she actually got a volume increase of 16 mils. And that volume is still there 12 months later. But ideally, what we would recommend is to do your initial course, and then you might do one treatment every maybe 3 or 6 months, and just a one-off to keep them results maintained.
Yeah, and I think once you get the results, you want to keep them.
Absolutely,
definitely. And can that work alongside, say, the likes of botulinum toxin injections or fillers? So, I know that's a question my patients ask me.
Yeah. Yes. Yeah, and it definitely does. Like, it works absolutely amazing with the likes of your injectables. I find with toxin, we're normally kind of knocking out the muscles, and we're normally targeting the depressor muscles.
That's right.
With M-Face, we are only targeting the elevator muscles to give that nice lift. So it works extremely well with your toxin. And obviously with filler, I find that a lot of injectors will place filler a little bit different after M-Face. They find they don't need as much product, and it lasts a lot longer because we've built back up that foundation that we've lost as we've started to age.
Absolutely. It's the first treatment. It's the foundation treatment of your treatment protocol, and then you move on in your journey then. That's how I'm working it in Elite anyway.
That's the best way.
Yeah.
And what is our recommendations then, Michelle, for Botox and filler if you've had it?
So after Botox, we wait 2 weeks to do the treatment. After filler, it's about a month. Yeah. But if you've done your course of M-Face, you can get your Botox or your filler done straight away. There's no kind of in between that you have to wait.
So on the note of Monaco, ladies, you weren't there for the launch. There was a big launch party on Saturday night on the yacht with Leslie and all the team. And the reason the launch was on was because they launched all about the awards and the CMAs, and you are the headline sponsors.
Yes, so we're so happy to be the headline sponsors again this year. They're actually been amazing. I've attended the last 3 years, so this will be our 4th year attending, and we're so proud now to be headline sponsors. It's probably one of the most prestigious aesthetic awards in Ireland. So it's going to be on in the Claude later on in the year.
And do you know what date it actually is?
Yeah, so it's fallen on the 29th of November.
Lovely. So that's plenty of time to get a dress.
Yes,
absolutely.
Cannot wait.
Super excited.
So am I. I'm definitely going to be there.
Yes.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Obviously, there's so many more devices, and we could talk for the next hour on M-Face. I mean, you can tell we're passionate about it. But other devices in your portfolio, you've got Exion and Exilis. They work really well with M-Face, I believe.
Yeah, definitely.
So maybe we'll go Exilis or Exilis, whichever.
Exilis, same thing, same machine. So you have one of these in your clinic. So a really versatile machine. So this can treat over 20 areas on the face and the body. On the body, we have the option to do fat burn and skin tightening, and on the face, we just want to do skin tightening. So this is our radio frequency and ultrasound together. A great device because it's so versatile, and was one of our most popular devices, and I think it kind of gets lost along the way because we get new shiny devices and everybody's into that, but it's become really popular again. One of my favorite devices, especially because it's non-invasive. You can get such an amazing lift on the face, and really does tighten and tone. You're boosting your collagen and elastin as well with that.
Yeah, we get fabulous results with it, and we love it. We're very passionate about it, and we've posted even for the likes of loose skin, for tightening the skin on the abdomen. That's a really difficult treatment.
Absolutely.
And we've got phenomenal results with Exilis, which as well. Exilis also offers the body, face, but also we've got MFEM as well, which is the vaginal rejuvenation treatment, which goes really hand in hand with the Mcella chair. I mean, their portfolio just covers every
we have too many.
We have so many devices, and we work together a lot, but we sell different
totally
devices.
different, yeah.
So we're always complementing each other devices because everybody is looking for something completely different.
Yeah.
And whereas a patient might come into you for one thing, they might not have even heard of your Mcella chair, and all of a sudden you open a conversation and the next thing it's changing that patient's complete life.
That's right. Mcella. And when we talk about Mcella, well, its nicknamingly is the best seat in the house.
Yes.
And so when we're there, we might as well talk about that treatment. If you are happy enough, ladies.
Of course. So Mcella, I suppose, is around 8 years now. So it is around quite a long time. We've over 15 clinical studies done on it. It's proven to work on all types of urinary incontinence for both male and female patients. Again, it's a non-invasive procedure. It only takes 28 minutes and it's the equivalent to doing 11,000 Kegels. But because we're bypassing the brain, it's pushing your body to work to 100% of its ability to really get the best out of your Kegel exercises. It also works for sexual function for both male and female. And as you said, it really, really complements your MFEM treatment.
It does. I find we would recommend a course of your Mcella first, and then they may progress to needing the MFEM, but that's not always the case. That is our gold standard package in the clinic, but sometimes you find we've got them where we need to with the 6 sessions, and then we put them on a maintenance program and we're on the homeward stretch. And I mean, incontinence isn't something that should be acceptable.
No.
You know, it's usually due to aging, post babies or menopause or surgical reasons. So, but it's not acceptable. And what we have noticed, and your statistics show that it's 75% reduction in pad purchases. That's afterwards. I mean, that's profound.
Yeah, and I think the fact that men and women can avail of the service, you're fully clothed. You again can come in on your lunch break. It's a 28-minute treatment, very comfortable. And again, we have found like more and more people are talking about incontinence now.
Definitely.
It's not as taboo as it used to be. So it's more, we have clinics who have it in their waiting area. So people are sitting on the chair while other patients are coming in and out, which is great. It just means that it's becoming more and more normalised now, which is really good.
And it's nothing to be embarrassed about. They say there's about 200 million people worldwide that suffer with incontinence. So it's nothing to be embarrassed about, but it's great that there is a non-invasive device that we can really target treat that.
I think it's amazing. I mean, I took it to one of our local shopping centres, and I mean, Foytside were fantastic. They let me put the chair out and talk about incontinence. I had to be obviously PC because it was, of course, and be careful what we were saying. There was a lot of little ears around, but you know, it was really funny when the chair came off the stage. The swarm of people around then, and I found when as well, you've been at my place when we've had events. I mean, that's the busiest room. You know, there's a queue, and it's not just for the ladies.
No.
We have got some fantastic results with the gentleman post prostate cancer and post surgery. His results have been life changing. You know, and that's why I'm here, and that's why I started this business. You know, was to make life changing treatments for patients and improve their confidence. And I think the Mcella chair is, you know, hats off, ladies, that's your machine, you know.
No, it's amazing.
And we're lucky to work for a company. All our devices do exactly what they say they do. So when we place them in a clinic, we know that they're going to work.
Yes.
And that's like half the battle for clinics as well, because it is, you know, our devices are the best that we can possibly make, and we're always tweaking. So we're always bringing out the latest innovation, the newest thing, but it is all backed by years and years of research. So when it gets into the clinic, it's not like it's just been made. It's been made 5 or 6 years ago. It's been tested in a trial market. It's tweaked and to within an inch of its life. So when it goes in, they know it's the best possible product.
Yeah, it's really well backed. And talking about new devices, well, we know we've the M-Fuse, but before we go on to that, you've got the IPL device, isn't that correct?
Exolite IPL. So this is one of our legacy devices, but in my opinion, one of our best devices, the results that we are getting from that. So we can obviously treat pigmentation, we can treat vascular lesions, so redness, rosacea, broken veins, we have skin rejuvenation, it does hair reduction as well. It literally does everything. And the results that our clinics are getting are just mind-blowing. Like, especially for pigmentation, the lift is really strong. And for vascular, we've had some amazing results with rosacea patients whose skin has been literally flared, and within 1 to 2 treatments, their skin is almost completely calm. So, I mean, from a patient point of view, it's such a quick fix that they've topically tried stuff. They might maybe have gone on medication for it and nothing has worked, and they're getting a treatment. They're in and out in 40 minutes, and they're seeing phenomenal results. So it's great, really good.
You can feel her passion about
I know.
It's
her favourite machine.
Have you had the treatment yourself?
Oh, of course. All the time.
Of course, we had 1 or 2 treatments. And the M-Fuse, and this is
The
a new
Infusion. So we
Infusion.
have just launched Infusion. We launched it in the Institute of Dermatology, and they are getting phenomenal results with it. So this is our newest device. It is the only device currently on the market to treat the skin barrier. So again, for an impaired skin barrier, there's nothing there that we can use. There is no device on the market that just targets that, and the results from this, even in the short space of time that we've had it to market, are just mind-blowing. So we're using on a lot of rosacea patients, and we had some patients say that they could use topically nothing on their skin, not a cleanser, nothing, and now they're on a full skincare regime. And that's after maybe 3 or 4 infusion treatments.
And what's entailed in the actual treatment?
So we start off with like an activate and refine, where you're infusing loads of ingredients into the skin. So we use a biocellular mask as well. And we also use a seal at the end just to lock everything in. So all the ingredients we're using are really hydrating, really calming, and really to infuse calmness and hydration into the skin. We also have a dynamic resonance in our device, which is a new technology. It uses sonic waves, so it's almost like shifting the cells so that we can get more permeability into the skin. And we're working on the calcium gradient. So you'll hear a lot more coming up now about calcium gradient and how as we age, our calcium gradient gets lower. And so our cell turnover isn't as quick. So for myself in my late 40s, everything slows down. So instead of being 30 days, it could be 60 days, 90 days. And what we're really trying to do is boost the calcium gradient so we get that nicer cell turnover. So if you imagine for somebody who's really, really sensitive and really, really like red and rosacea and that, the result that they get is just to cool and calm the skin completely. And that cell turnover is really strong as well.
And this is a facial?
It's a facial treatment.
Lovely.
Yeah. It's
And
a facial device. Really, really
many?
relaxing. So we say, depending on the patient, 4 to 6,
Right.
1 every 4 weeks. But the treatment itself, we've both had it. It almost gives a plumping effect to the skin. So you feel like you've actually had filler after the skin. Your skin is so calm and fresh. You keep wanting to just poke your skin because your skin just feels so bouncy after it.
Yeah,
Well,
it's amazing.
Lovely. If you need a model.
Yes, of course, Emma.
Sounds good.
Emma's coming in the back of the car with us.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.
Other devices, you have your M-Sculpt Neo. This is a lovely device, folks.
Yeah, so M-Sculpt Neo, it works similar to M-Face. So it's all about skin tightening, but also fat reduction and then muscle building. So depending on the patient, you might do maybe a course of 6 or 8 treatments. But after your course, what you'll see is you will see 30% reduction in fat, 25% increase in muscle strength. So really, really good for gym goers, but if people just want to kind of kickstart healthy diet and lifestyle as well, to kind of give them that start to on their weight loss journey. But an unbelievable device. Again, really, really comfortable. You can treat up to 11 different areas. We have 3 different types of applicators, so you can really target people's area of concern.
So what areas? So 11 areas.
Yes. So I suppose the most common is obviously your abdomen. Everybody wants to get rid of their tum. As we get that little bit older, you can do your bum, you can do your thighs, you can do your tricep, biceps, calves. So there's a lot of different areas that you can treat.
Wow.
We found as well a lot of people on GLPs
Yes.
are now going because they've lost muscle tone. So they're now being prescribed by their GPs to start something with a lot of muscle building, which is your Neo. And again, 30-minute treatment.
Yeah.
It is like the dream.
It is.
Lie down and
it's very tolerable.
It really is.
Actually, it's quite relaxing. I think at the lower, it kind of feels a little bit like zizzy, but then as it goes higher, you just get used to it.
I think in Monaco, I attended one of your talks and he talked about the GLP-1s, which is like the likes of Wegovy and Mounjaro and Ozempic, and which was great. They're fantastic for weight loss, but obviously now we're realising that people not only were losing fat, but they were losing muscle. So now with further research, it's like, yeah, it's okay to lose the weight, but we want you to lose fat, not muscle. And this is where the Neo comes in.
Yeah.
Just to sort of rebuild that muscle. I can't remember the doctor's name that spoke about it, but he was fabulous. It was an American gentleman. And his speech was brilliant. But it just sort of thought, that really makes sense, because obviously we do GLP-1s in the clinic. Yeah. And one of the things we do say is your protein intake is so important, because I want you to lose fat. I don't want you to lose muscle, but it's very difficult to isolate. So this machine is fantastic, for that. And as well, M-Face is really, really good for the Ozempic face that we've seen as well. So
definitely, because it's building back up that volume that we lose and that muscle that we have lost, and can really bring back the structure to the face. And the same with the body with M-Sculpt Neo. So they work really, really well with the GPL ones. Exactly.
And as well, we've a lot of celebrities now hooked up to both Neo and M-Face because of that.
I think I saw, was it Kim Kardashian?
Kim Kardashian on M-Sculpt Neo. She's a big fan. We also have Megan Fox is another big fan. Jennifer Lopez, to name a few. But yeah, they're all big fans of M-Sculpt Neo. Yeah.
Well, if I could look like them, I would be on it morning, noon and night.
You have one in the house.
Yeah, no, let's just take home. Yeah. Have you tried it yourself?
Yes, I actually got married 2 years ago, so I done M-Sculpt Neo before my wedding, and I had a flat stomach for the first time in my life. So no, really, really impressed. And as Rachel said, it's a really comfortable treatment to have done, but the results just speak for themselves.
And 30 minutes, how many crunches?
20,000.
Yeah.
I wouldn't do 20,000 in a lifetime.
Not in a week, a year.
I could try, but no, definitely couldn't.
And remember, you're doing it to 100%. The machine is overriding your brain. So look, we'll all say we were in the gym and then we might get a bit tired or whatever, and you're not fully really into it at the end, whereas this does not let you not be into it. It's like 100% the whole time.
Is there a BMI limit for patients to go on the device?
So there's no BMI limit, but I suppose you just have to prescribe the right course for the patient. Right. And it's not going to, you have to do it in conjunction with a healthy diet and lifestyle. The device can only do so much, but I've seen people of all kind of weight categories do it, and they've got really, really good results, because it will still really help build their muscle. And obviously with the radio frequency, it will help melt that fat as well. Yeah.
I think, again, it's like anything in aesthetics, realistic outcomes.
Realistic, exactly.
And manage expectations, if you're coming in and you haven't been at the gym in years, you're not going to get a six-pack.
No.
And how many sessions do you recommend?
So that's why consultation is key with any treatment, and it really varies. Our clinical studies are all done on 4 sessions.
Right.
But some patients might require 6, 8, 10, just depending on what they want to achieve and the results they want to gain. But most patients, of course, between kind of 6 and 8 is what I'm seeing kind of trending with all our clinics.
And your core to floor, that's a fantastic program that you've devised.
So I suppose M-Cella is all about pelvic floor strengthening, and M-Sculpt Neo is about your core. So when you do the two together, it's like a no-brainer. The results are absolutely amazing. I've found that some patients have even said their posture is massively increased. They feel that they're nearly 2 inches taller because they're standing a lot straighter, and they're a lot more kind of toned and engaged.
And so what the core to floor is, so you're having the M-Sculpt Neo, is that correct? And then you're having the M-Cella chair as well. Yeah. Excellent. Sounds like.
So an hour.
You're in and out in an hour. You can do the 2 in the same day as well. So really, really good.
And the core to floor obviously is for your postnatal patient.
Postnatal, but anybody really. I remember a podcast, Dr. Hugh O'Connor, who's an amazing gynecologist in Dublin, and he was talking about M-Cella, and he was like, who cannot benefit from 11,000 Kegels? Everybody. And it's so true. A lot of people don't even do their Kegels correctly because they don't know how. So with the M-Cella, as Rachel said, it is bypassing the brain and pushing your body to work to 100% of its ability. And then with the M-Sculpt Neo, we're targeting the core muscles. So really, really complements each other.
Yeah, it just sounds perfect.
Yeah.
It is. And even people with lower back pain have done courses of Neo and said that they have found that their posture and their core is so much stronger afterwards, that they're not getting as much tweaking, or they're not pulling out their back as often as they used to do.
Yeah, because it has just been cleared for rehabilitation of muscles as well, FDA approved. And a lot of the time with lower back pain, it's been coming from weak glutes. So if you target your glute muscles with the M-Sculpt Neo, it can really help with lower back pain.
That's excellent. I didn't know that. That's brilliant. And other devices, you've so many. Lymphostim.
Another one of our favourites.
Yes.
So anytime we share a hotel room, Michelle is on the lymphostim room. So you hear the so our lymphostim is for our lymphatic drainage. It's our bodysuit. So you zipped into it. You're fully clothed. Just wear your socks and your jeggings or whatever. And you can do for cellulite. You can do it for detox, general well-being. So it's like we never fully detox the body. So the lymphatic system cannot detox itself. So we kind of refer to it as a rubbish truck that comes in, takes all the bad lymph away and excretes it out through sweat, through urine. It is the most comfortable treatment. Most people are doing it now for like sleep patterns, anxiety, stress, just as a general like healthy and well-being mindfulness treatment, but really good as an add-on. So if you're having M-face and you want to hop into the suit, or you're having something more invasive like a little bit spiky like our Exolite, you can pop in and it just calms people down completely as well. So it's a really good treatment for both.
And it's really good for rehabilitation. So if somebody does a lot of road running or a lot of kind of heavy lifting, I actually just had my nephew over at my house the other day who's a rugby player. And obviously he's kind of getting a lot of injuries, but it will help with the healing of any kind of bruising, any injuries as well. It will just speed everything back up.
Build up of lactic acid. So if somebody's in the gym and they're doing a heavy leg session and there is a heavy leg program on it for 45 minutes afterwards, they can go back into the gym the next day. They have no DOMs, they have no, like their recovery is way quicker.
Yeah. Funny, I've actually reached out to our local football team to offer the gentlemen to come in, which they have accepted. So I'm excited to see what happens there, and I'm sure my staff will be delighted as well.
We might come up that day.
Do you want to help? And don't do what I did and put my husband in it back to front and nearly kill him.
We won't talk about that.
It was a little tighter than he expected, let's just say.
We got an extra service.
So what's new then? What's coming next?
I suppose with BTL, we're kind of starting to launch ExoMind, which is like TMS, so transcranial magnetic stimulation. It is all about healthy brains and treating the brain to make it that little bit healthier. So that's what's coming later on in the year. We've also some other stuff in the pipeline that we cannot talk about, unfortunately. They keep us in the dark a lot in headquarters. Like, so BTL, like our headquarters is in Prague, in Czech Republic. And they're constantly kind of working on stuff in the background. In Prague alone, we have 450 engineers just working on the new devices that are coming.
Wow.
So it is, it's pretty impressive.
So the ExoMind?
Yes.
ExoMind. I have seen it on social media, and I've seen it in America already. Yeah. So I'm excited to hear more about that.
Yeah.
Stay tuned. Probably next month or the month after that, you'll see a lot more about it.
And we're going to fully launch it in October. So It's not fully launched till then.
So Ireland will be October.
Yes.
We'll watch this space.
Yes.
Excellent. Well, thank you, ladies. It's been really interesting. And as you can tell, we're very passionate about these machines because they work, basically.
Do what they say they will.
Definitely. And can I just say about M-Face, I actually completely forgot.
Absolutely.
So we have and we're so proud, we've just hit 1 million treatments.
Wow.
So it is the fastest growing non-invasive device on the market. So we're just so proud to be hitting that big number.
Wow. Is that just Ireland?
That's just across the world.
Wow.
So in the shortest space of time.
Excellent.
Yeah.
Elite might be responsible for a few of those boxes.
Definitely.
Yeah, we love it. We absolutely do love it. If you're looking for a model in the clinic, the staff are all up to M-face straight away. So when the girls were training, it's like, oh no, my mum's going to get this one.
Yeah.
you were there that day.
There,
yeah,
and
it
her
was
results,
lovely.
even after one, like
she's
she was
looking
really
fabulous.
impressed. Yeah.
So she's had 2 now, maybe 3. And she's looking great.
God.
So
And prevention is better than cure. So,
that's it.
Anybody can start it at it like 30 plus if they're finding they're getting volume loss and stuff.
And mummy's well and truly 30 plus. But we'll not say her age on camera because she will kill me.
She will.
Well, ladies, thanks very much.
Thank you.
This
Thank
has
you,
been
Emma, for
brilliant.
having us on.
You're very welcome. So I'd like to say thanks to the ladies. Obviously, you can tell BTL are way in advance with their technology, but it's just to let you know that there is something else out there other than injectables. So if you're interested in the BTL machines, contact the team, or if you're interested in some of the treatments and you're in the Northwest area, give Elite a shout.
The Aesthetic Podcast from Local Women Magazine. This podcast is brought to you by BTL Aesthetics Ireland, supporting clinics with aesthetic solutions.